The number one threat to nurses is back injuries from overexertion. Some patients may only need a steady hand to hold, however, others may need complete assistance. This frequent strain on the nurses can lead to serious problems if the lift isn't performed correctly. To properly maneuver a patient, a nurse should always feel confident with the task. Always allow the patient to help as much as they can. When difficult situations arise, it is recommended to use the two-person assist technique. Nurses should verbally coordinate their movements with each other and the patient to produce a safe and controlled lift. Proper form includes lifting from your legs while keeping a straight back. These precautions can help nurses sustain strength and prevent injury.
The second most common injury for nurses is slips, trips, and falls. These are easily preventable but happen so often when a nurse becomes tired while working a long shift. A room like the one shown here has equipment that could be tripped over, and a patient's room can become easily cluttered, so it is important to keep walkways clear. Spills happen but need to be quickly cleaned up to avoid slipping.
When working in healthcare, infectious diseases are a hazard. On the left are a list of common infectious diseases one might come across as a nurse. That being said, these are not the only infectious diseases out there. On the right are some precautions to be taken. First, stay home when you're sick. Don't let vulnerable people come in close contact with you. Second, if you must be around others, wear a face mask to prevent spreading or breathing in germs. Third, cover your mouth when you cough or sneeze. Use a tissue or your elbow to cut down on the possibility of transmitting germs. Fourth, wash your hands thoroughly and often, especially after sneezing or coughing. Fifth, avoid touching your face or other people without PPE. When in contact with patients, you should wear PPE, and depending on the case, this includes gloves, masks, gowns, caps, face shields, and shoe covers. Sixth, always make sure to dispose of sharp/needles accordingly to avoid possible contamination.
Hazardous waste includes any discarded substances that contain infectious material. Listed on the left are some examples of hazardous wastes that are commonly found in healthcare facilities. Not only are healthcare employees susceptible to the dangers associated with medical waste, but patients and others within the facility are equally potential victims. Healthcare employees can prevent any serious problems regarding hazardous waste by learning and understanding how to properly dispose of it. This includes classifying and separating the waste correctly, as well as preparing and using the appropriate medical waste containers.
Oxygen tanks are found frequently in hospitals, nursing homes, and other facilities. It is extremely important for nurses to monitor the safety of these tanks due to the heightened risk of fire and explosion. Oxygen is very flammable, therefore it is extremely important to keep it away from any heat source. Oxygen tanks should be stable in clean and clear areas. The increased amount of oxygen present in the air is not easily detected by humans. If a heat source is in proximity, clothing or hair is likely to catch fire first. This danger could affect the patient as well as those caring for them. Proper care of oxygen tank is very important in nurses' safety.